Hi everyone, and thanks a lot for appreciating my videos. Well, continuing with the videos in which I discuss and revise the entire topic in 10 minutes, here is my attempt to revise yet another topic, lymphomas. Yes, you heard it correct, lymphomas, a very tough topic, but I tried to ensure to revise the entire pathophysiology, the main diagnostic features, the biopsy findings, and the main cytogenetics. Not to forget the treatment of the major lymphomas that you should know for any exam, including INI-CET, NEXT, or the NEET PG. Let's start it. Now, first we'll start with what is called as the origin of the lymphomas. So what you see here, it's a lymph node, and in the lymph node, what you see here, this is the cortex part, a medulla part. In the cortex, I made this area as a follicle. Well, this area becomes a parafollicle area. Follicle has a B cells. Now, if I enlarge a single follicle separately, this is how a single follicle looks like. A single follicle has a germinal center, and germinal center has this is germinal center. This area is germinal center, in which you find a light zone and a dark zone. Light zone and dark zone with a centrocyte and centroblasts. Then you see a mantle zone, and outside this you see a marginal zone. Now, why do I need to know this? Why do we need to know this? Well, what happens is whenever a B cell is made in a bone marrow by a B lymphoblast being a B lymphocyte, it comes out as a naive B cell. This naive B cell enters a follicle, and at the various entry points there can be some mutations causing some lymphomas. For example, what comes out from a mantle zone would be a mantle zone lymphomas, and because a naive B cells comes here, a naive B cell can often give rise to what is called a CLL. Now, in a germinal center, it gives rise to lymphomas like the DLBCL, Burkitt's lymphoma, and it gives rise to follicle lymphomas. A questionable Hodgkin's lymphoma also comes from it. When you move to the marginal zone, a marginal zone area will give rise to marginal zone lymphomas. After passing this area, a B cell can make a plasma cell, which can give rise to multiple myeloma, and can give rise to what is called as a mature B cell, which can give rise to what is called as a memory B cell, and memory B cell has to be proposed to give rise to what is called as hairy cell leukemias. Now, based on this, let's move to the basic lymphomas, and the first one is what we call as a normal lymph node histology. See, this is a normal lymph node histology. Now, keep this in mind, and when you compare this to the normal histology in a magnified view, a dark zone, a light zone, a mantle zone is what you must know in a normal lymph node. Now, keeping these two things in mind, let's start with the first one, and that is what is called as a CLL. So in a PS, what you see is a college girl appearance, and along with that, what you often see also is this cell called as smudge cells. Okay, you can also call this a convent girl appearance. A better term is convent girl appearance, not a college girl appearance. Look at this. What you see here is a diffuse effacement of lymphocytes by the small lymphocytes. Now, look at this biopsy finding, and now understand in a clinical biopsy, you find 2P. 2P means a pseudofollicular pattern with what is called as a proliferation centers. This is very, very important finding what you find in the CLL. The main mutation is 13q deletion, and that causes a microRNA of 1516 that is causing mutation. Now, second lymphoma is a mantle zone lymphoma, which also comes from the mantle zone. Remember, a mantle zone lymphoma has a translocation of 11 with 14. 14 becomes always constant. The 11 is cyclin D1, which is coded by a gene called as BCL1. So this you must also remember. In some cases, what happens, the cyclin D1 is negative, and those cases are diagnosed by what is called as SOX11 gene. Again, a very important question. A CLL and a mantle zone lymphoma, they both are a mature B cell, so 19 is positive, and because they are coming from the mantle zone, CD5 is also positive. But a CLL is 5 positive, 23 positive, a mantle zone lymphoma is 5 positive and is 23 negative. Okay, now next one is what is called as a follicular lymphoma. What comes from a follicle? Yes. Now, follicular lymphoma, it often gives a biopsy like this, in which you see a follicle, and in this follicle, they often are positive for BCL2. How to remember? 2L with BCL2. Remember, the main translocation is translocation of 14 with 18. They also show a mutation of KMT2D mutation, a very, very important one. Okay, and remember, they are not with BCL1, they're positive with the BCL2, as you see in this IHC, which is actually coming positive in BCL2. In which area? In the germinal center areas. Okay. Next one is a diffuse large B cell lymphoma. You heard it correct. The most common NHL and the most common NHL of every other organs. Remember, it is positive for BCL2, but also for BCL6. In fact, it's more positive for BCL6 there. The two varieties very important here. One is an immunodeficiency variety, and one is a primary effusion lymphoma. A primary effusion lymphoma is very importantly asked as it's positive for HHV8 positivity. Okay. Next one is what is called as Burkitt lymphoma. Now, in this case, very importantly, what you see is a Yes, a mandibular swelling showing a starry sky appearance. As you see in this biopsy finding, you see a starry sky appearance. Look at the starry sky appearance. These are all the macrophages and it's all the tumor cells. Now notice these are all the ALL3 morphology cells often seen in the bone marrow finding of a Burkitt lymphoma. From B for Burkitt, B looks at chromosome number 8. And remember, the gene is a c-MYC. So c-MYC is on chromosome number 8. Remember, the main translocation is, yes, 8 with 14, but other you must remember is 2 with 8 and 8 with 22. The most common variety being endemic variety, seen in African population, and 100% cases being positive for the Epstein-Barr virus. It's very, very important. Remember, the treatment here is R-CHOP. Yes, rituximab, and along with the CHOP, you all know is cyclophosphamide, doxorubicin, vincristine, and methylprednisolone. Next comes a hairy cell leukemia. A hairy cell leukemia shows what is called a hairy cell. As you see in this image, a hairy productions contains mainly what? Yes, they contain the Golgi bodies and they also contain the ribosomal complexes. Now, they're best seen on a phase contrast microscopy. Remember, they are often positive with the BRAF gene mutations, and on the bone marrow, what they show is a fried egg appearance. Remember, peculiar finding, they show pancytopenia, but they definitely shows monocytopenia, not monocytosis. They often are stain positive with annexin A1, DBA44, and TRAP positivity. A typical CD marker you often get a question in is CD103. Because they are BRAF positive, they often stain positive with, they often are treated with a BRAF inhibitor called as Vemurafenib. Okay, so next one is a rouleau formation you often see in multiple myeloma. Yes, a multiple myeloma which often belongs to a plasma cell neoplasm, and remember they show a rouleau formation. A typical translocation you see is chromosome number 13q deletion. Translocation 11, 14 is often positive, 4, 14 is positive, and 14, 16 is also positive. But the good prognosis is 11 with 14. Remember the CRAB findings: C for hypercalcemia, R for renal failure, A for anemia, and yes, B for the bony lytic lesions. Okay. Remember the most common antibody you see is IgG. Remember the mnemonic GAMDE in the decreasing order of the sequence. So GAMDE is a very important mnemonic you will often get. SLIM is a criteria which defines a myeloma defining events. 60% plasma cells with light chain more than 100 involved to uninvolved, and MRI of 2 or more than 2 with more than 5 mm in size. Remember, the alkaline phosphate level is normal here. A counterpart is Waldenström macroglobulinemia, in which you find high amount of IgM. Okay, now look at this multiple myeloma showing this punched out lesions, and look at the typical eccentrically placed nucleus. Remember, they show Mott cells, yes, grape cells, and they also show inclusions which can be in the intranuclear or can also be in the intercytoplasmic. We'll call as Dusher bodies and Russell bodies respectively. Remember, the treatment for this is, yes, bortezomib, which is actually a proteasome pathway inhibitor. Okay, proteasome pathway inhibitor. Hodgkin's lymphoma is yet another very important topic which you must all know about. Remember, a Hodgkin's lymphoma, they are positive with Reed-Sternberg cell. This is the RS cell you often see. Along with this, what you see is a eosinophil. Now, a typical RS cell has a binucleate ouli appearing, right? And some cell are very importantly here. Look at this. What is called as? Yes, it's called as mononuclear cell, seen in the, yes, it is called as a variety, what you call is M for mononuclear, M for mixed variety, the most common variety in India. Mixed population, mixed variety. Well, nodular sclerosis shows a lacunar cell. A lacunar cell, this variety is most common seen in the world. Yes, and then you see what is called as a popcorn cell, P for popcorn, P for the predominant variety. So NLPHL, NLPHL. Now, also have to remember here the classification of a Hodgkin's lymphoma. It is often classified as a classical and non-classical variety. All the classical varieties, which includes mixed variety, nodular sclerosis, lymphocyte rich, and lymphocyte depleted, they all are positive for CD20, negative for CD20, but positive for 15 and 30. A non-classical is negative for the 15-30, but they're positive for the CD20 marker. They also are positive for BCL6 marker in them. Treatment for this is, you all know, it is what? It is the ABVD regimen, which stands for adriamycin, bleomycin, vinblastine, and dacarbazine. These all are actually which? They all are the varieties of Hodgkin's lymphoma you must all know about. Finally, if you look at the T-cell lymphomas, a T-cell lymphoma is again very important. T-cell lymphomas, they have a Sézary cell, seen in Sézary syndrome, also called as cutaneous T-cell lymphomas. They can show you a clover leaf pattern in an adult T-cell leukemia lymphomas. And finally, you should know about the hallmark cell or called as horseshoe-shaped cell donor cells seen in anaplastic T-cell lymphoma showing ALK positivity and C30 positivity.